Hello and welcome to the AriaMedTour YouTube channel. In this video, I'll explain what gynecomastia is and how you can get rid of it. Stay with us. Gynecomastia refers to the unnatural enlargement or swelling of breast tissues in boys and men. In most cases, enlarged breast tissues in men does not cause any serious health conditions, but only brings about psychological issues. Men with such a condition usually suffer from poor self-image and feel discomfort with particular activities, especially sexual intimacy. There are some important things you need to know. All enlarged breasts do not mean gynecomastia. Gynecomastia is a condition that can happen to overweight and obese men, which is the bilateral deposition of fat in their chest. Real gynecomastia is the enlargement of glandular tissues located around the nipple rather than fat deposits. In other words, an overweight person can easily get rid of large fat tissues on his breasts by doing exercise or liposuction, while gynecomastia cannot be removed by losing weight. Gynecomastia causes. Hormonal factors play a crucial role in this condition. Estrogen triggers female traits such as breast growth, while testosterone mainly controls male traits such as body hair growth. Males and females have both of these hormones in their bodies. However, testosterone is the active hormone in males and estrogen is the active hormone in females. Any imbalance between estrogen and testosterone hormones could disturb the process of their physiological mechanism. In males, for example, an increase in estrogen levels compared to testosterone may lead to gynecomastia. Genetics, some diseases, malnutrition, cancer, use of anabolic steroid, and some medications could lead to the excess production of estrogen compared to testosterone, which may trigger breast tissues growth in men. Hormonal changes may also appear during the normal physical development of boys during infancy and puberty, which is usually temporary. Signs and symptoms of gynecomastia. The first sign of gynecomastia is swelling breasts in men. The disease is usually associated with the feeling of tenderness when the nipples are touched. In most cases, the patient feels no pain in their chest but finds it a little firm. Diagnosis of gynecomastia. Depending on your medical and drug history, the doctor can diagnose real gynecomastia. A careful physical examination is required to pinpoint the cause of disease. Your doctors may ask you to have blood tests and mammography to determine gynecomastia and find out the underlying reasons. In the next steps, further examinations including CT scan, MRI, tissue biopsies, and testicular ultrasound are usually required based on the results of your initial tests. When the above-mentioned examinations are done, the doctor may diagnose gynecomastia or any other conditions such as breast cancer or the presence of a fatty breast tissue. Gynecomastia treatment. In some cases, gynecomastia goes away without going under the knife. However, enlarged breasts with more than 4 cm in diameter may not completely disappear. There are non-surgical and surgical approaches. Medications. There are a number of medications prescribed for this condition, but none of them have been approved by the FDA. These include testosterone replacement therapy, clomiphene, tamoxifen, and danazol. Diet changes. Some believe that certain food could lead to a shift in hormone levels. These foods include canned food, soy, shrimp, beer, protein powders, strawberries, and multigrain bread. Instead, it is recommended to eat low-calorie, nutrient-rich food, and those with anti-inflammatory properties such as berries, leafy greens, citrus fruit, and beans. Laser therapy. Laser therapy is a non-surgical method that targets the cellulite caused by gynecomastia. The process requires a long course of treatment to help you get rid of large boobs permanently. You may still be suffering from gynecomastia despite trying non-surgical and initial options. In this case, your doctor may recommend gynecomastia surgery. There are two main surgical techniques for gynecomastia surgery. Liposuction. It is more suitable for those whose large breasts are resulted from the accumulation of the fat cells. The procedure involves inserting a thin tube through a lateral incision on the chest and removing excess fat or glandular tissues from it by vacuum suction. The procedure is typically done using local anesthesia. Excision techniques. In cases in which glandular breast tissues or excess skin should be removed, the excision technique is suggested. This technique may involve reducing the areola and repositioning the nipple. In the excision technique, the surgeon makes incisions in breasts, through which he or she can access the excess tissue and remove it. Excision technique is an outpatient procedure and you won't have to stay in the hospital overnight. In some cases, your doctor decides to implement a combination of the therapies to achieve optimal results. That was all for today's episode. I hope this has been helpful in giving you some basic information about gynecomastia. Please subscribe to our channel by clicking here so that you won't miss our next episode. And feel free to ask any questions in the comment section below. Also, visit our website at AriaMedTour.com and check out our Instagram page to learn about what we do and who we are. Thanks for watching. Bye for now.